Hello, welcome back. This is now our sixth discussion. Over the last 5 weeks, we've talked about resilience, we've talked about compassion and bravery, we've talked about innovation, we've talked about UIC strengths, and then last week we talked about how proud we all are of our graduating seniors and graduate students and residents that are finishing this month. Today I want to talk about what I would call a staged re-entry, and to bring everyone up to date on some of the various aspects and issues that we've been doing. You need to think about a staged re-entry kind of like a plane in a thunderstorm, if you've ever had that opportunity. When the pilot's trying to land, it is often in a thunderstorm, there are updrafts, there are downdrafts, and sometimes the plane gets pushed side to side, and everyone on the plane can get shooken up a little bit, but the plane is engineered and the pilot has the expertise to be able to land that plane safely. We're in very much that same issue right now. And I wanted to let you know that all of the plans I'm going to bring you up to date here are those that have been based on information that we've gotten from the CDC, from OSHA, from the American Dental Association, and from the Illinois Department of Public Health and the Chicago Department of Public Health, along with, where appropriate, the Illinois Department of Finance and Professional Relations, which governs the licensing issues. So first of all, I want to talk about education and the changes that's occurred in educational programs. And I want to thank Dr. Tony Ruca for her hard work. There were 5 goals that were put together in how we needed to manage the educational programs. And the first was to try to minimize the disruption as much as possible to the curriculum for both the dental students, the advanced standing students, and of course the postgraduate students. We wanted to try to maintain the sequencing of the course content. We wanted to maintain, of course, the physical distancing, which is important. And we wanted to preserve the integrity of the assessments that are used, because this is very important in terms of meeting the college's competencies and our CODA standards, which is really important for the college and for the students' outcomes. To do this, there were 4 planning task groups that were put together. The first was on didactics, and this was led by Dr. Phil Patston, and this is along with Dr. Brown and Dr. Doubleday, Dr. O'Day, Dr. Barra, Dr. Narvakar, and Dr. Ashrafi. The second was a task force on the pre-patient or simulation clinic and how that would come back. This was led by Dr. Priscilla Chang, along with Adriana Semprum, Dr. Courtney Lamb, Dr. Sweetan, Dr. Gerke, Dr. Yuan, and Dr. Ashrafi. The third committee was for the clinical integration, and this was led by Dr. Rowan, along with the managing partners and Jennifer Barakis and Dr. Yuan. And the fourth task force was on graduate and advanced education, led by Dr. Cooper, along with the program directors of the 6 programs, Dr. LeHue, Dr. Nicholas, and Dr. Wu. Each of these are putting forward what we call Plan A and a Plan B. So Plan A is where a strategy has been put into place to where we would be caught up by December of this year, 2020. Plan B, which is if we get an updraft or a downdraft on trying to land this plane, we may get caught up, and it may be not until May of 21, but we need to plan nonetheless. Let's talk for a second about the clinic reentry, because that is probably the most challenging issue that we're dealing with. And this is led again by Dr. Rowan, and as I've mentioned before, we have faculty from the College of Engineering, and along with staff from the engineers of the central facilities helping us. The central theme on this, of course, is the concept of administrative controls as well as engineering controls around aerosol mitigation. So some of the ideas that we have so far is, of course, physical spacing and distancing. There's going to be mandatory PPE training, which is through the CDC modules. The students have already started with this. This is going to be mandatory for all faculty and staff as well as the students. There's going to be monitoring of the donning as well as monitoring of the doffing or taking off the PPE, because it's very important. We have looked in the dental student programs with a co-provider model of 2 students to 1 patient. We're looking at shorter sessions and looking at potentially 4 sessions a day. Again, with the central theme of aerosol mitigation and safety for the students, for the faculty, and for our patients and staff. We are looking then at separate entrance for where faculty and staff and students would enter the building versus where patients would enter. We are also looking at, as has been put forward, that people will come to school in street clothes and only change into scrubs on site, and then dress again at the end of the day into street clothes when they leave, with the idea that if there is contaminant, it would be on the scrubs in the bag that would then be laundered. We are obviously doing copious hand sanitizers throughout the building. We have a triage system that will stay in place in terms of patients being contacted 24 hours before with a medical history and dental history review that I anticipate will continue. We are prioritizing what I call urgent time-sensitive procedures and separating those from time-sensitive procedures with the idea of prioritizing patient care as we start to do a phased reentry. We're looking at risk profiling of patients based on the anticipated procedures, and therefore, especially the highest risk would be those that generate an aerosol, such as an air water syringe, an ultrasonic, and of course the high-speed handpiece. Now, what we are looking at is staggered appointment times to help to deal with the inflow of patients that come in. We are looking at check-in temperatures, and we are also looking at controlling the number of escorts that would come with a patient, because that just adds to the complexity of the onboarding of patients each day. We are looking at changes to the HVAC system, and that really is coming down to this idea of increasing the number of air exchanges. Today is a beautiful day and it would be nice to have the windows open, but we know that that's not always the weather in Chicago. We are looking at vacuum systems, and we are looking at modifications of the high volume suction adapters that we have in the clinics. We do have a new cleaning crew in the college, and they've been doing a deep cleaning, and that will continue with the deep cleaning for as long as, I'd say forever now, because we do need it and we always need it. But it's a very dedicated new staff, very conscientious. They always have been, but now they know how critically important they are. We are looking at standardizing, for instance, the N95s, the face shields that we have, the bonnets, and of course the hand sanitizer. Part of this is going to be based on availability of the different kinds of PPE equipment as we go to standardizing procurement and standardizing the equipment that we have for everyone being safe. I'm going to be honest, there are some challenges. One of the big challenges is the elevators and physical distancing, and how we are going to be looking at staging patients as they are escorted to the respective clinic. There's also an issue, as I mentioned, with the availability of PPE of all types. And we know it's going to slow down clinical efficiency in doing this, and that's what I call an air pocket that the plane just got caught in. Now, at the advanced educational clinics, which is under Drs. Rowan and Cooper, there is a phased plan strategies that each of the program directors have provided, looking at a phased walk-in to various clinical activities, again using the urgent time-sensitive procedures first over the month of May, and it's going to be a gradual, slow reentry. In terms of research, I have to thank Dr. Cooper, and along with the Vice Chancellor Groden, who has set up a series of task forces on campus to actually address the issues of the research community as we look at a reentry to all of the variety of different activities in terms of the research. There was a research town hall held this past Wednesday on the 29th, and we also have a group called the Environmental Health and Safety Office is now doing an individual laboratory check with each PI to make sure and assure of the safety of the activities in that lab. PPE equipment will be available through clinical affairs for the research community, and this is, I'll give you an example, is again deep cleaning, physical distancing, limiting the number of people in the lab, staggering work and work hours, but again following the same rules as everywhere else in the building, temperature being taken, and where and location in the building while they're in the building. I foresee this is going to continue for at least a foreseeable future. One question that's come up with every one of the town halls and with the faculty meeting is the issues with public transportation. This is the Metro and of course the CTA. John Coronado, the Vice Chancellor for Facilities, and Wayne Giles, the Dean of the School of Public Health here at UIC, has been working very closely with the Chicago Department of Public Health and CTA to verify and help them in terms of the various deep cleaning protocols that have been going on the trains and on the buses. As you know, there's been a lot of changes that has occurred with the CTA in terms of how you can use buses. And again, this is all dealing with deep cleaning, the physical distancing where possible, and the use of PPE equipment, which I would suggest you bring with you if you're going to take the train. But this is, again, a big challenge, and this will be a challenge as the city begins to open up. Again, campus is working with trying to address these issues, such as right now, parking is available in the month of May, and they are now evaluating the availability of parking come June. I've been just having conversations today with campus facilities about what are those options and when a decision is going to be made. So to summarize the re-entry of the plane in the thunderstorm, first of all, it takes the experience of a good pilot, and I want to actually say I have a great group of pilots with all the with Dr. Rowan, Dr. Ruka, Dr. Cooper, all of the people on the administrative team, all the department heads, and all the program directors all make for a wonderful crew to land this plane safely. It does take this, it takes resilience, it does take compassion, incredible innovation. Everyone is working on the fly and creating great things. Everything that I've seen from the group in the pre-patient care simulation to the managing partners has been incredible in terms of the plans that they get. Because at the end of the day, what we want to do is get everyone back safely and be able to get our students completed and get our research completed as soon as possible, but in as safe a manner as possible. This is what makes us UIC proud, and that makes me extremely proud about the entire team of the faculty, the staff, and the students here at UIC. So thank you again, and more to come.